Hello everyone. Today we're looking at healthy eating with lung disease. When you have a lung disease, the key is to eat well every day. But what makes up a healthy diet? The Eat Well guide seen on this slide shows us how different foods and drinks can contribute towards a healthy, balanced diet. It is based on the 5 food groups and shows us how much of what we eat should come from each food group. Starting with fruits and vegetables. Why do we need them and how much should we have? Well, fruits and vegetables are a great source of vitamins and minerals, including vitamin C and potassium. Antioxidants reduce inflammation in the body and help to boost your immune system, reducing the risk of you getting infections. They're also an excellent source of dietary fiber, which can help maintain healthy gut and prevent constipation and other digestive problems. A diet high in fiber can also reduce your risk of bowel cancers. We should be eating at least 5 different portions per day, and these can be either fresh, frozen, canned, or dried fruit. 1 portion is equal to about 80 grams, or 1 handful. Moving on to starchy carbohydrates. Why do we need them? Well, carbohydrates are your body's main source of energy. They help fuel your brain, kidneys, heart muscle, and central nervous system. Starchy carbohydrate foods are our main source of nutrients, such as calcium, iron, and B vitamins. Fiber is also a carbohydrate that aids in digestion, helps you to feel full, and keeps your blood cholesterol levels in check. Dairy isn't necessary in the diet for optimal health, but for many people it's the easiest way to get calcium and vitamin D, which is highly important if you're at high risk of osteoporosis from the use of steroids. Here it's recommended that you have at least 3 portions of dairy per day. Dairy also contains proteins that needed to keep your heart muscles and bones healthy and functioning properly. Always choose low-fat options if you're over a healthy weight, and full-fat options if you are underweight. And remember, there is just as much calcium in skimmed milk as there is in full-fat milk. Proteins are really important when we're looking at the growth and repair of your body. They contain lots of vitamins and minerals and are a good source of iron, zinc, and selenium that are important when we're looking at your body's immunity and healing processes. Proteins are also important to maintain muscle strength and a healthy immune system, and we should be eating 2 to 3 portions spread over the day. Fish is also a really important source of protein. It's recommended that we aim for at least 2 portions of fish every week, one of which should be oily. So which fish are considered oily? Well, we have sardines, mackerel, salmon, trout, herring and kippers, pilchards and crab. Tuna, however, does not count as an oily fish, either whether it's tinned or fresh. Dietary fats are essential to give your body energy and to support cell growth. They also help protect your organs and help keep your body warm. Fat is also a source of essential fatty acids, which the body cannot make itself. Fat helps the body to absorb vitamin A, vitamin D, and vitamin E. These vitamins are fat soluble, which means they can only be absorbed with the help of fats. Good fats, such as monounsaturated and polyunsaturated fats, are needed in the diet every day to maintain HDL, or good cholesterol. Saturated fats and trans fats are bad fats, and we need to include less of these fats in the diet every day to reduce LDL, or bad cholesterol. Vitamin D is very difficult to get from the diet alone, The body makes vitamin D under the skin from sunlight between the months of April and September. It is then stored in our fat. Vitamin D also helps to regulate the amount of calcium and phosphate in the body. These nutrients are needed to keep bones, teeth, and muscles healthy. A lack of vitamin D can lead to bone deformities such as rickets in children and bone pain caused by a condition called osteomalacia in adults. It is recommended that all adults have 10 micrograms of vitamin D per day as a supplement during the winter months. You may be having this with your calcium supplements. Check with your pharmacist and GP to make sure. Sugary foods and high-energy snacks contain very few nutrients. They can increase your weight and therefore put extra pressure on your lungs and heart. And they can also contribute to mood changes and mood roller coasters. As we know, having salt in our food can make it taste much nicer. But having too much in our diet can lead to high blood pressure. So what tips would help someone to reduce their salt intake? Well, we could stop adding it to cooking and stop adding it as an extra to our meals. Be careful with sauces, soups, ready meals and cheese, as they usually contain a content of salt. We can opt for unsmoked meat and fish and use more herbs and spices to season our food. And be careful, always read food labels. Alcohol should always be taken in moderation. Remember that alcohol can interact with some of your medications. We should be taking no more than 14 units per week. And remember that alcohol can lead to dehydration, which again can make the secretions on your chest very thick and sticky. Have a look at the diagram below to see what a typical unit is. Some of the issues you can face if you're not eating well. You can find it difficult to breathe. You may have a loss in energy and reduced immunity. It could take longer to get over infections or respond to medications. You can get a loss of muscle mass and muscle strength. And it's more difficult to cook and buy food. Here are some ideas of the foods that you can keep in your store cupboard for when you're not eating well or feeling too well. Tinned foods like fruit, rice puddings and soups are always good to keep in a cupboard. Ready meals to keep in the freezer. Easy cook foods such as eggs and frozen veg. Have in softer, moister foods such as fish, cottage pie, etc. Buy UHT milk, as this will last longer, or powdered milk. Bought over-the-counter supplement drinks are also helpful for when you're not eating well. Complan, Meritine, Ames, powdered shakes or soups, and nourishment ready-made drinks like Complan smoothies. If you're struggling to eat due to difficulty trying to breathe and chew at the same time, remember, try to have a window open or a fan on your face, as this will give you the feeling of extra space. Eat soft, moist foods, and eat small, frequent meals. Graze throughout the day if necessary. And remember, take your time. Chew your food before you swallow it. If you're struggling to eat, however, due to difficulty with a dry mouth, you need to keep yourself hydrated, drinking up to 8 glasses of water per day. Again, you can eat soft, moist foods that are easier to swallow. And try sugar-free gum, frozen grapes and citrus fruits to help you produce more saliva. It's really important as well to limit your salt intake, as that will have a drying effect on your mouth. And rinse your mouth or gargle with water frequently. If, however, you struggle to eat due to bloating and trapped wind, remember you need to try and relax when you're eating and sit upright. Eat slowly and chew your food well. Avoid fizzy drinks and gum, as this can make the bloating worse. And eat fewer gas-producing foods such as cabbage, sprouts, broccoli, cauliflower and beans. You may wish to try peppermint tea, cordial or capsules, as this can often help with bloating and trapped wind. Also watch your salt intake, and if the symptoms persist, speak to your GP. So, in summary, here are a few things to remember. Eating a balanced, varied diet will help you keep well and maintain a healthy weight. Enjoy your food and keep an eye on your weight at least monthly. Have store-cupboard standbys in your home for when you're unwell. Keep them where you can access them. And speak to your pulmonary rehab team or GP if you're worried about your weight. If you'd like to learn more about your diet, then please follow the helpful links below. And remember, you can always ask a member of the team for any further advice if you need it.